Great. Well, thank you everyone for having me again. I enjoyed the last time I got to visit with you just when COVID was upon us. And so I'm happy to share about the eligibility and services for the regional center. When I think of folks who have Asperger's syndrome or other disabilities, it must be really confusing because there are so many agencies out there and you know something's up and you're just not quite sure how to go about straightening out the situation. And hopefully I can help with that. I wanted to talk a little bit about the basics of the regional center, then eligibility specifically as it regards to high functioning autism. So it's important to understand the history of the Lanterman Act. The regional centers in the late 60s, early 70s, the only option if you had a child with a developmental disability was to put them in an institution. So at its peak, Fairview and Costa Mesa had about 3,000 residents. And it was actually mothers who went to state legislators and said, we want to keep our kids home. Help me do that. And from that, the regional center system was born. The important thing to remember here is, at this time, autism is what I call old-fashioned autism, where the idea of autism was that the person sat in the corner and rocked all the time. And the goal of the regional center was to keep people out of institutions. So it was really developed for people with severe impairments. And that's where some of the challenges you'll run into for folks who have high functioning autism. Back in the day, Ronald Reagan was governor. He was not a fan of big state institutions. So they devised the regional center system, and there are 21 regional centers in California. Fortunately for you, there's only one in Orange County. There are 7 in LA. Each has their own procedures, their own guidelines, and that makes life more complicated. So we are the only regional center in Orange County. We administer 3 different programs. 2 of them I'm just going to tell you about so you know they exist. The first is for Early Start. This is for young kids under the age of 3. The whole idea is identify kids who are slightly behind, get them services, get them better, so they no longer need services. The second is Provisional Lanterman, and this is for slightly older kids, age 3 to 4. And this is for kids with more significant impacts. But again, the whole idea of this is to get kids early to try and get them access to help. Lanterman services are very different. And the reason they're different is because if you're Lanterman eligible, what we're saying is you have a lifelong disability and it's not going to get better. Now, to be honest, that's hard for me to say for my 3-year-old, much less another person's 3-year-old. But that's that is the eligibility criteria we have to abide by. And we'll get more into the eligibility criteria in a minute. I wanted to talk briefly about the services we provide. It really depends on each person's need, and there are specific guidelines for each service. If you're eligible for the regional center, you'll have a service coordinator who kind of acts like a social worker. And there will be a multidisciplinary team who will work with you to decide what is it that's important to you, what are your life goals, and then we will try to find agencies to help you meet those needs. And that might be, for example, referrals to the Department of Vocational Rehab. We're also a family advocate. We're especially good for folks where English isn't their native language, or folks who are not too savvy in terms of navigating various systems, and we can help with that. Importantly, we are not in the healthcare business. We don't fund healthcare. That really goes through the health plan. let's talk, there's an entity within the regional center called the Comfort Connection. And it's really important that you know about this because the Comfort Connection is open to everybody, regardless of whether or not you belong to the regional center. And we can help families with resources. We can do parent-to-parent support. We can do all kinds of, they can do help you in all kinds of ways. And specifically, if you're even interested in applying to the regional center, that's something that they can help you with. And you can go in person, you can contact them by phone or via the RCOC website. And that is, again, you don't need to be a regional center person to access that. Okay, so let's talk about eligibility criteria. And again, these are the state rules. If I was king, I would have made different rules, but these are the rules we are required to follow. And the first is that you must have an eligible diagnosis. And we'll talk about autism as an eligible diagnosis as well. Importantly, you must meet severity requirements, and these are called substantial disabilities. So that simply having a diagnosis does not make you eligible for regional center. You need to show severe impairments in at least 3 areas, and we'll talk about those areas in a minute. It needs to be likely to continue indefinitely. So that if, for example, I was seeing a young teen who was continuing to make significant progress, I would question whether or not they would have a lifelong substantially disabling developmental disability as defined by the Lanterman Act. It also has to originate before the age of 18. That's really not an issue for autism. It is for some of the other things that we cover. Okay, so the eligible diagnoses, just so I can mention them, intellectual disability, cerebral palsy, epilepsy, and then there's something called the 5th category, and these are conditions like intellectual disability. These can be things like genetic syndromes, traumatic brain injuries, that it's kind of like an other category. And it's actually a really good thing that the state put that in because there are people who don't fit into a simple box. But for our perspective, at least, the most important thing is that autism is an eligible diagnosis. I should share that the special education criteria for autism are much less restrictive than regional centers, and a formal diagnosis of autism is not required to be eligible for autism under the school district. So there are many kids in special ed who are eligible special ed for autistic-like behaviors, and they're not eligible for the regional center. I talked a little bit about the substantial disabilities, and these really come into play with folks with high functioning autism. Certainly age is taken into account. What I expect from a 3-year-old is different than what I expect from a 10-year-old, which is different than what I expect from an 18-year-old. We have to differentiate between can't do a skill versus can do a skill and chooses not to. And, you know, for parents, if you have an adolescent that's not doing something, it doesn't really matter which of those two it is, it's just not happening. But again, can do but chooses not to implies that there's room for growth, and that would make us question whether someone was eligible for the regional center. Okay, so so these are the areas of substantial disability, and they vary a bit based on age. So the first 5 are for everybody. Independent living, you wouldn't expect a 4-year-old to be independent, have any independent living skills. It starts in when you're 6. So for example, can they make a sandwich? Can they take a shower? The kind of higher self-care skills that kids acquire as they grow older. And then there's economic self-sufficiency, and that's, can they hold down a job? And that we would apply for people over the 18. And practically speaking now, for people with high functioning autism, almost by definition, their learning and language are okay. Otherwise, they wouldn't be considered high functioning autism. Mobility is rarely an issue in people with autism. So without those 3 categories, as a result, most people with high functioning autism would typically need either the last 3 categories to be eligible. Self-direction is basically social skills. So almost every individual with autism is substantially disabled in the area of self-direction. So they need 2 other areas. If they're if they're age 6 and above, they would need independent living skills and possibly self-care. And again, when people are older, economic self-sufficiency. So that is why many people with high functioning autism are not eligible for the regional center initially, because they don't meet those criteria. And again, if I were king, I would make different criteria, but these are the criteria we have to follow. And I hope that makes sense. Okay, so we have this thing called substantial disabilities. How are they determined? There really is no single test that I can point to that says, yes, someone is or isn't substantially disabled. So we look at a whole lot of information. We look at the information provided by the person, their family, their teachers, their therapists. And we look at past psychological testing, past educational testing. Test scores are typically at or below the 2nd percentile, and that's really low. So someone who's functioning at the 10th percentile is clearly impaired, is clearly not at an age-appropriate level, but they're not severe enough to meet the criteria for eligibility for the regional center. And that is, again, where that substantial disability comes in, and we're really looking for individuals who are severely impaired. Sometimes there are people that it's just hard to sort out. The school says one thing, the parent says another. There are different tests that show different things, and in those cases, we'll actually see someone to try and sort that out. But the more information we have about you, the better we can reach an accurate assessment. So this is my granddaughter, Bryn. This is a couple years ago, and Bryn has high functioning autism. And she's the kind of girl that if you spent 2-3 minutes with her, you probably couldn't tell she had autism, but if you spent 5 minutes or longer, you would see it was pretty apparent. And cognitively, her skills are in the average range, her language skills are good. So right now, she would not be eligible for the regional center. I mean, she lives in Las Vegas, so it's not a practical issue, but just as an example, she would not be eligible for the regional center, even though there ain't no doubt about it, she definitely has autism. So let's talk for a minute about being diagnosed with autism late in life. And periodically we'll get someone who's in their 30s, 40s, 50s, who has a late diagnosis of autism. And they'll say they didn't diagnose autism when I was a kid. And there's no simple answer to that. And we have seen a bunch of these cases, but the sad truth is that there are really lousy services available for people with mental health problems like schizophrenia or bipolar disorder. So what we sometimes see is someone with this long psychiatric history who graduates from high school, and then everyone's like, okay, what do we do with the person now, because they're just at home? And they look at the suite of availability of services available to the regional center, and they get a sudden diagnosis of autism. So again, I've seen that both ways. So the review of the early records is essential. And I understand sometimes, schools don't keep records from 50 years ago, but the earlier the records, the better. And the question is, were those behaviors and characteristic features of autism described? Were there those repetitive behaviors, the social isolation? Even if it wasn't formally diagnosed, does it seem like it was there? And as we look back, do those early diagnoses seem accurate? So people who are diagnosed with autism late in life, I would certainly encourage you to reply if you felt appropriate, but the more early record you can give us, the better we can assess and try and sort that out. Because it can be really difficult to do with someone late in life, and there's nothing for us to go by other than a family member saying that, they had these features that seem like autism. And we get those occasionally. We do our best to sort those out, but the early records are really helpful, if that makes sense. So what happens if someone's found ineligible? If someone's found ineligible, they can basically request a judge review our records. People can always reapply to the regional center. So when I showed you the substantial disabilities, it's not until later in life when some kids with autism are eligible. And parents will say to me, I hear this all the time, that parents will say to me that, their 3-year-old, I want services now so that my child can continue to make progress and not need your services when they're older. I totally understand that. As a clinician, that makes total sense, but there's no support for that view under the law. The law says that the person in front of me today has to be substantially disabled in 3 areas, and I have to be convinced that it's lifelong and not going to significantly improve. But regardless of the age, anytime we make a decision, it can be requested to go before a judge. And if the judge agrees that the person should be eligible, I'm fine with that. Okay. Finally, I wanted to talk about how to contact the regional center. Our phone number, fax, and website are listed. My major plea, as I've kind of hinted at, is records are essential. The thing that slows down the eligibility process most often is records. And if there's an individual in a person's life who can speak to that person's disabilities and the problems they've caused, that is super helpful. Unfortunately, the way the system is set up, you don't get eligibility by all the great things you do. You get eligibility by the problems you have. So the more we can have an understanding of that and a documentation of that, the better. That's pretty much my talk. Let me go through some of these questions.
Yeah, so put your questions in the chat, or you can raise your hand. I don't want to take too much time because we have a lot to cover, but someone was asking about services in Seattle. Do you happen to know what type of support there is in Washington, Peter?
Not at all.
Okay.
I do not at all.
Regional Center is a California-specific program.
It is a California-specific program, and the services available are better than 95% of the states out there. I think New York and Massachusetts, and I would think Washington's are pretty good, but there are states where only a certain number of people are eligible, and you have to wait for someone to die or leave before you can be made eligible. So California services are way, way better than most of the other states. Regarding the question, when you say initially, does that mean you can reapply later depending on circumstances? Absolutely, yes. The only way it gets difficult to reapply is if you go that fair hearing route and a judge says you're not eligible. That's a much higher bar to come back from. But if we say you're not eligible at age 5, you can come back at 10, you can come back at 15, you can come back at 21. So yes, people can reapply depending on their circumstances.
Is there any, I'd like to ask a question while, I don't know if anyone else has, part of my son is 30. So back when he was 30, I mean, there was barely any services available. LOVOS was called LOVOS, it wasn't called ABA, and it certainly wasn't paid for by insurance. So a lot of the trajectory for individuals with autism has improved because of all the different therapies that are now available that maybe weren't available. But sometimes they cost money, and the earlier interventions is so key. And so that's why someone who might have a very young child, best if they could get started by around 3. So how does that get rationalized, this issue of chicken and the egg, I guess? People are doing better with autism because they get therapy, but they may not be able to get therapy because they have autism. Or their trajectory is better.
It's maddening. I wish I had a good answer for that. We try to take it on an individual basis. And there are parents who have said to me, yelled at me, so you're saying if I didn't do anything for my kid and they were really bad, they'd probably be eligible? And probably yes, which is awful. But that's law, and that's what we have to follow. One person here asked, I heard you have to qualify before 18. You don't have to qualify before 18. You have to demonstrate that the problem was present before age 18. So that if you, and for autism, it's a developmental problem. That's generally not an issue. Where that gets sticky is we get a 40-year-old with autism and bipolar disorder, and it's hard to sort out what's the bipolar disorder and what's the autism, especially if the autism wasn't diagnosed till age 40. But for the vast majority of people with autism, because it's a developmental problem, the under 18 is not an issue. Where the under 18 becomes a problem is we will see a 60-year-old guy from Vietnam who is obviously very impaired, but we have no medical history, and we have no idea if they had a stroke when they were 50, if they were born that way, and that's where it gets really difficult. But for the vast majority of people with autism, the 18 issue is not an issue.
Okay, why don't we take one more question? Savag asked, how do you prove that you were autistic before the age of 18 if there is a late diagnosis?
Just because by definition, autism is a developmental disorder. People, in our understanding of autism, people are not, don't suddenly develop autism at age 20. Autism is a developmental disorder that starts in the childhood period, which is again why we look for those records to document that. So that's why.
Okay, thanks so much, Peter.
You're very welcome.
Yeah, go ahead.
No, unfortunately, I have another meeting I have to run to, but if there are any other questions or people, I would encourage people to reach out to the regional center or to the Comfort Connection if they're curious about applying and would like to learn more.
Thank you, Peter.
Thanks.
Okay, Emmanuel, I'm sharing the document that Kathleen shared. Now, Kathleen is with Comfort Connection. She hosts a meeting, I think at least once a quarter, that I attend with other nonprofits. So one of the things she does is work with the other nonprofits and helps us collaborate together. She is currently planning on working more with transition programs. So that's something that's for adults. So that's something in the future. But for now, I'd like to welcome Emmanuel, who is, you're an area supervisor?
Yeah,
okay.
Area supervisor here at Regional. So good evening. Dr. Himberg definitely shared a lot of the information, that kind of leads us into the services that Regional Center provides. So Kathleen was kind enough. This is available at the Regional Center website. She just, I think, modified it a little bit just to make it a little more summarized for today's meeting. But what we're seeing here, it's basically the services that are provided once you're part of Regional Center, right? This is the jobs that come with your service coordinator. So just so you guys have a little bit of the backstory of what goes on after you have those IPP meetings or even those initial IPP meetings, So in the background, you have your service coordinator that's assigned to you once that eligibility period is taken into account and you're determined to be eligible. So behind the scenes, the service coordinator is constantly going through consultations. They're providing information on any upcoming classes, workshops through Comfort Connections. They're definitely also kind of coordinating any support with the family, coordinating who's in that circle of support for this individual, for your child, whether it be, a neighbor, a teacher, whatever it is, but mainly to formulate a plan that is well-rounded and addresses, the goals that we're trying to see for each individual. Into that also leads into that future planning. We know that we all have an end time. We would love to live forever, to be there for our loved ones, but we all kind of have that time where it's our time to go. And so part of the service coordinator's job also is to help guide those conversations early on, and being able to incorporate that into the plan that we're formulating for each individual, whether it be, who's going to be that point person, is there any burial plans, what are the preferences, all these things, because we want the IPP to reflect from the small term goals that we have to long-term goals. We go on into, what we were talking about, service coordination, and that looks in a very variety of ways. That's coordinating supports through different agencies, that's looking into the community and seeing what's there, and always just providing that support for families. And the beauty of Regional Center is that we do have access to our specialists like Dr. Himberg, other BCBAs, nurses, and a well-rounded team that whenever it's necessary, we're able to go to them as service coordinators and brainstorm and see what resources or what paths we're able to explore to be able to meet these goals. And the support groups, kind of how Dr. Himberg shared, that is really guided through our Comfort Connections and Kathleen, just putting together information for family members to be able to join support groups, just to be able to receive that support and that guidance and even just advice sometimes that we might need. So now we get into a little bit of what's available for, our older individuals serviced by Regional Center. And I can't stress enough, your best point of contact is your service coordinator, because the beauty of Regional Center is that we strive to be individualized. We want to formulate a plan that's specific to each one of your guys's children. And so what we look like, I know that today we want to focus a little bit more on our adult services. I know that you guys might have heard from, our living options. We have definitely heard also from our employment services. So we just want to recap the services and supports that are available. So once a individual reaches either a high school diploma or a certificate of completion at the age of 22, they're eligible for our adult programs and also employment. Now we have a variety of adult programs. Thankfully, Regional Center has a lot of vendors that are able to just service in a very different capacity, and they try to encompass every possible individual. So we have so many different types of day program, and I just wanted to list them off. But basically in our traditional model, we have community-based day programs, we have site-based day programs, behavioral management day programs, and finally, for our more kind of medically impacted, we have adult day healthcare centers or community-based adult services. So all these day programs are guided towards developing self-advocacy, independent living, vocational training by volunteer work or paid work, but they're formulated to kind of encompass to continue developing skills and continue to help progress in the skills that they're able to develop. We also have supported employment programs, and through those, we often coordinate and work together alongside the Department of Rehabilitation. We, depending on the level of need and the level of support, it goes from Department of Rehab funding these services to Regional Center taking them over. Because we understand that sometimes our individuals want to work and want to have that value of getting a paycheck and so forth. So there is those supported employment or day programs for them to be able to transition outside of the district services. We go a little more into behavioral services. We understand that ABA for insurance is kind of how Judith was sharing, so much has changed throughout the years. And now with insurances kind of being obligated to fund for ABA services, they start stipulating and looking for those limitations or criteria. So one of the biggest ones that we know is, for example, Medi-Cal or Cal Optima, their funding stops at the age of 21. We understand that sometimes individuals might need that additional support past the age of 21. So that's where Regional Center is able to look at behavioral services continuing after, Medi-Cal or these private insurances have been explored. I know that we have a crisis support service in here because it is something that we're able to put together. What I always like to emphasize is Regional Center is not a crisis support agency, but we understand that sometimes things happen, and we are fortunate enough to have one or two vendors where they have the staff available to try to coordinate. I know that everyone has been aware of just the staffing shortages across all job fields, and our vendors have not been ones that have been exempt from this. So it is listed there. I always say service coordinator is your best point of contact to seeing how that crisis support service is able to be explored. Interpreting and translating services, like Dr. Himberg said, we definitely would like to focus our support into those families that English isn't their first speaking language. So we want to provide as much support as we can. And we go into the living options. In the living options, we have a variety of supports. We have our licensed community care facilities, where that is where your child or adult is able to go in. Their license, they have 4 to 6 individuals, and it's basically them living in a home with the appropriate number of supports, right? Depending on their level of need, from daily living to behavioral support, but that is in there. We also have a variety of different supports kind of looking into the independent living training, and that is a wonderful tool that I always encourage, especially when we're in that transition period. 22, I think everyone kind of has a sense of, I want to conquer the world on my own. And I think that this independent living training is phenomenal for these individuals that are kind of getting to that age where maybe they want to live outside the family home. They want to have a roommate, they want to live with their high school friend and so forth. So it allows them to continue building those independent living skills while they're still living in that family home. How to budget, how to meal prep, how to compile a grocery list. And then we go more into the independent living services, where an individual might need a little bit of support, but they're already living, they have their own apartment, or they're trying to navigate their own apartment. And they just need those reminders, those check-ins, that organizational skill training for them to be able to organize all their doctor's appointments, making sure that their benefits are up to date. But then we also have supported living services, and these are individuals that might need a little more hands-on support, more than our independent living, whether it be, due to a living need in the fact that they're not able to fully care for themselves, but we still want to encourage that independent living. So we do have that additional, just more hands-on support. We have medical, dental, and nursing services. I always like to emphasize, our private insurances, our generic resources as Medi-Cal or Cal Optima are always our first line of defense, but there is times where, for whatever reason, something isn't covered. And by all means, we're able to look into if that is something that is within regional center's power to being able to fund. Medical equipment and supplies, that's the same thing. There is assessments that are made through our specialists to coordinate and just determine if that is something that we're able to fund for. Mobility, so we are able to, mobility and transportation, that first and last bullet point kind of go together. So we are able to offer transportation services, and that can look a variety of ways for them to be able to go to a job, a college, or just vocational training, their day programs. That can look in the form of public transportation by us, funding a reduced bus fare pass, access demand coupons, or even as far as getting a participant directed parent vendor where an individual of your choosing is able to transport them and they get reimbursed. And that mobility training is where we're able to have a agency or vendor train them to utilize those public transportation so that they're able to navigate the community at will. We also have personal assistance. We understand that the older that the individuals get, sometimes there is that still physical or even medical need that is needed. So personal assistance is available in those cases where parents or even that individual might need that additional support. Post-secondary support. So we like to coordinate, if there are individuals that go on to colleges and so forth. So we like to always present them with resources and push them in the right direction as their disability department and whatever college they're going to, or just coordinating with the resources that are available through the community and made aware to our adult resource group specialists. And then there's always respite care for these individuals that are living still in the family home. They're still eligible for respite so that parents are able to receive that just break from providing that supervision and that care for each individual. Despite, them being 22, we understand that sometimes parents still need that breather. But that's really the encompassing of what's available to our adults. Dr. Himberg made a very good point. Once we're made eligible for regional center, it's not that, you fit into this criteria, now you're eligible for these services. It's you're eligible for regional center services. So you're eligible for everything. However, it doesn't mean that everything applies, right? We want to be individualized. We want to look at what the goals are, where we want each individual to be, and how are we going to help coordinate, whether it be regional center, department of rehab, social service agencies, to put together the supports in place to reach those milestones and those goals. All right, I think I am right on schedule. But
you're right on schedule. There is a question in the chat. Manuel, would you mind answering it in the chat? Do you think that would be okay?
Yeah, let me see.
So you can do that, yeah. And I just wanted to say that Regional Center's been a good friend to the Orange County Asperger Support Group and has spoken to us a number of times. We've had Arturo Gutierrez speak about the employment programs. We've had Jack Stanton speak to us several times about living situations, and all those sessions are recorded. So Manuel did a great job kind of summarizing the services, because we often get asked. But I guess the first person you should go to is your service coordinator to try and figure out what the services you need.
Definitely. And I think that's what they were asking, if we can get a copy. I believe it is in the region.
Yeah, I'll be sharing this with everybody. So not to worry, Manuel. I'll be sharing both yours and Peter's presentation.
Definitely. And the last thing, like you shared, my advice to all the families, and even the families that you guys are in contact with, is your service coordinator is your best point of contact. They're there to coordinate this, and then utilize them as much as you need, bouncing off questions and just brainstorming. That is part of the support that we're able to provide for each one of you guys.
Okay. Thanks a lot, Peter. Thanks a lot, Emmanuel. Okay.